back from this report. And for couples out there that would need, we can say couples therapy, it's very useful if you need to talk through certain emotions. Who might need couples therapy, it could be a very useful tool if you need to talk through certain emotions and specific aspects of your relationship. So we have been joined by Dr. Abdullah Habib, Doctor of Psychiatry and Director of Clinical Neuropsychology at Mindwell, as well as Dr. Sara Alsayed, Doctor of Counseling Psychology and Director of the Department of Psychotherapy and Counseling at Mindwell. Good evening, doctors. Dr. Abdullah and Dr. Sara, it's a pleasure to have you with us this evening.
It's a pleasure to be here. Thank you.
Always happy to see you again, Rita.
Of course. So today we're talking about something we usually don't bring up a lot, which is couples therapy and couples issues. So we hear about individuals going to therapy, and we're starting to normalize that. But couples therapy is pretty new to us. So Dr. Sara, what is couples therapy and how is it different to normal therapy that we know?
So as you said, I think the most famous type of therapy is individual therapy. There are different kinds of therapy, such as couples therapy, family therapy. Today we'll be focusing on couples therapy. The difference between them is, in individual therapy, it's one-to-one. It's the psychologist and the client gets to really kind of delve into issues in multiple areas in their life. So social life, work life, education. Whereas with couples therapy, it's different because it's highly focused on the relationship and the couple comes in together. So sessions are, based on the psychologist interacting directly with the partners and focusing on, the issues that they're facing and the goals that they have to better their relationship and, increase communication or kind of find coping mechanisms that are healthier to get through whatever troubles they're going through.
I can imagine how hard it is, although, yes, that's your partner, but it's not as easy to be completely vulnerable in a therapy session, having someone that you know very well with you during therapy, because we have a hard time discussing what we went through during therapy with our family members or even our spouse. So, Dr. Abdullah, what should a couple expect in couples therapy?
So, again, since it's a complete different kind of platform than individual therapy, and before we do counseling therapy, normally how it starts is one of the partners singly comes to the clinic and requesting to be helped and talking about some kind of issues within the dynamic of the relationship. Some of the things that we tend to let people know or what to expect in couples counseling or couples therapy is that we tend to not just focus on the couple as them working together, but we also focus on them individually. And that is a very important component because if you think about it, even though they're in a couple, they're both their individual person. And before they come together in any form of relationship, they had their own life, their own wants, and their own hobbies and different things. And now they have part of the relationship, they have to do certain sacrifices in order to make this relationship more fruitful. And so that is something that we have to keep in mind as the counselor or as the psychologist during this process, that each one of these is an individual person which has their own kind of thought process. They have their own sacrifices that they've been doing in the relationship without the other person knowing.
Yes.
And then we also focus on them together as a unit and as a team, how the dynamic of the relationship is happening. So one of the most important things is for people to understand is that when we do couples therapy, we are not just focusing on you as a couple, we're focusing on different aspects of the relationship. So we're focusing on the individual, we're focusing on you together, and of course if there's any children or any other family members involved, we look at the overall view of the family that plays part and all of these are separated into different kind of segments of the couples therapy.
So we're definitely focusing on the family as an entity altogether, not just the individual during couples therapy. But would you recommend that a couple would actually be seeing the doctor individually or another doctor individually, or can all of this be solved together while both of them are present in the same appointment?
Yeah, I think Dr. Sara would have more insight onto that, because that's kind of her field of looking into counseling and how to patient. But so I think, is that something that you would experience, as having patients?
Yeah, one thing I would actually, before getting into that, add to what to expect in couples therapy, and go based on what you were saying in terms of the team. It's so important to also know, because some couples will get a bit anxious about, feeling like, oh, will the psychologist team up with my partner, or will they take sides? But that's never the case, right? So the psychologist is always a neutral entity within that dynamic of three people. And what they will do is they will equally encourage and motivate the couple, but they will also equally challenge the couple. So what will happen is also in sessions, you'll find couples go into the fights that they would have at home within the session, and what the psychologist will do is sit back and observe. Observing that is very important, because we're getting a live representation of actually what's happening at home, and so we can start to pick up on unhealthy patterns in their communication, the way that they react, their facial expressions, their body language. So that's another thing to take into consideration. Now, to answer your question about what to expect, it's funny, sometimes I'll have couples seeing me separately, and I've had instances where the couple didn't even know that they were seeing me. And then when they found out, they were like, okay, great, so the psychologist already knows us on an individual level, so let's start couples therapy together. Other couples might come in directly for couples therapy. They know that they have an issue that they want to deal with and they want to face, and so they make the decision to start off as couples therapy. And then, as Dr. Abdullah said, some couples may come in for individual therapy and then realize, okay, wait a second, there's something in my relationship that needs to be dealt with, and then we would include the partner. Couples therapy can be a long-term process, or we can sometimes include a partner for a few sessions in the individual process, just to deal with, minor issues that they might be facing as a couple.
It definitely depends on the case of the couple or the individual, how the treatment plan works.
Yeah, and I think a very important point that Dr. Sara mentioned is that talking about your problems is not easy, especially when we talk about intimate problems or relationship problems, and talking to a stranger that is, it's a trained stranger, but still at that point we're a stranger. But a big aspect of the field that we work in is privacy is the most important thing. As Dr. Sara was saying, she had patients that were in a relationship and they were both seeing her individually, yet they didn't know they were talking to each other, even though she knew they were in a relationship, because you can technically even put one and one together. They would mention the name, they would say the age, they would say the same problems, even if they didn't deliberately in some way say it. You would kind of see it, but we wouldn't tell them, we wouldn't say anything, we wouldn't use any of that information against them. So it's also important for any person to know that any information we tend to get out of any therapy session with any clients, whether it's individualized for the therapy of the couple or couples counseling, it's always with what's within these walls of the room. And a big aspect of it, what makes it easier for them to understand, is when we let them know that it's private, and we let them know that anything they say in this room is non-judgmental. Whatever they say, it's a place where they can express themselves. And a big aspect of it is, a lot of times you get to see that this is the first time in a room they say what the problem is. Because a lot of times you're just fighting and you don't know what the problem is.
And it could drag on.
Yeah, and sometimes they think it's miscommunication. Well, you did this, you did that. But when you sit them down and you ask them, what do you think the problem is? And they just say it in one sentence. The other person sometimes is like, really? That's what is the problem? And it's just because they never sat down and had a person that's non-biased, non-judgmental, and not taking teams. A lot of times people think is, I'll go to a therapist or to a psychologist, and I will have them team up on my side against the other person. We will never, even if we agree with you on a personal level, we still will not take that. So you need to come to a decision as a couple. So our personal choices or preferences as a person never interacts with our advice or our guidance through therapy.
Yeah, and something important that you said about, you know, this confidentiality and the lack of judgment within the therapy room, we encourage them to do the same with each other.
Right.
Because, you know, because as Dr. Abdullah was saying, there's a lot of individual work that goes into couples therapy. So they're going to be talking about their past traumas, how that affects their behaviors. And so it's really important for them not to feel judged by their partner, to feel safe to voice things that maybe they've never shared with their partner before, very comfortably, without the fear of that being used against them in any way. As well as also therapy goals, right? So in individual therapy and in couples therapy, we encourage clients to really voice what their therapy goals are. What are you here for? It's really important for couples to have a shared goal, which is we want to work on the relationship. Because if one partner is coming in wanting to work on the relationship while the other is not motivated to do that,
that's not going to change.
It's not going to
even
work
after all the sessions of therapy.
Exactly.
Since you mentioned that, why do you think couples decide to come and see a couples therapist? Is it because they're trying to fix the relationship, or is that the last resort before they break things off?
We hope it's not the last resort. You know, we really hope that couples could make the decision to come into couples therapy as a preventative measure, so that they don't reach that point where, you know, the damage is so bad that it's difficult to actually restructure or fix. Couples will decide to come in usually because they've tried to fix it themselves. They've tried to communicate with each other. They've maybe also had friends or family intervene, and that didn't help. And so what they'll do is they'll decide to go for a third party that is, again, neutral, disconnected, not biased, to help them communicate those issues and find ways to cope with them.
That makes a lot of sense, because we usually go to our family, our mom, the closest person to us, our friends, and there's always bias, no matter what the situation is. So I think it's really important to actually go see a doctor early on before it's a bit too late. So, Dr. Abdullah, what do you think are the most common issues that couples do face?
I think the most common one, well, I think this is just because we're human, it's miscommunication. I think the biggest problem we have is sometimes I would say something and the way you interpret it is completely different than what I would mean. For example, let me say, I would ask you a question. Are you good in telling stories?
Right.
What would your answer be to that? Are you good in telling stories?
No.
Okay. And what did you understand by that question that I just asked?
If I could tell a story well. Or
what kind of stories?
Maybe a book or something, yes.
But I could be asking, are you good in telling stories as in a lie?
True.
But it's the same question, but the way you understood it is completely different than what I meant, because it's dependent on what I'm saying. So if something as simple as such a question can cause you understanding something and I meant something else, imagine when you were arguing, and now I'm saying something in a heated argument, and I'm upset, and my judgment is clouded by emotions, and I'm being a little bit frustrated. This can, in some ways, explode to a point that we're not just miscommunicating at this point. Now we're just misinterpreting everything, single thing. The way you say things, the way you behave, the way your tone is, and you just take it in a different kind of state of mind. Other common issues we tend to see is, for example, infidelity. So either one of the couples having affairs outside of their relationship.
Very common.
And of course there's reasons for that, but this is a very common one we would see, is that a lot of times they would come in with kind of a complaint that we caught one of our partners talking to somebody else. Financial issues is a very common thing. So when finances in the relationship or in the marriage as a household is not doing well, so now they start argument about who makes the money, who makes the decisions, where the money's coming from.
A lot of stress, you're wasting it, you're not spending it right, and the kids come into it, and a lot of issues come out of that. As you said, trust issues can come from infidelity. So how do you deal with these issues usually when couples come in?
I think there's a while back we were talking in our clinic about common misconception, common issues that we have with communication, and Dr. Sara pointed out a very good, like normally in a clinic we always have these kind of team meetings where we tend to talk about different kind of theoretical frameworks that we use, and she brought up a very interesting one about when it comes to communicating and how we present it, and I think when people find out, and I think she'll share it with us now, but when people find out more about it and just are aware of it, it's something that it's very beneficial for them as a couple, knowing it before even coming in. As she was saying, we are not supposed to be the last resort. We're not supposed to be there when
Definitely.
things are at its worst, and we're supposed to kind of fix a broken relationship. We're supposed to be there at the beginning. And some of the things that she brought up that day, and she'll mention as well, is very important to this kind of constructing of the relationship.
Yeah, and I mean, I can confirm that really the main issue that we see is that miscommunication, the
Yes.
lack of communication, because other stressors can present themselves: infidelity, loss of intimacy, financial issues, more severe cases like physical abuse, emotional abuse. But if communication is not there, they will not be able to overcome any of these challenges
Right.
without that. And so the concept that he was talking about is one that we were literally just speaking about last week, and it's a theory called the Four Horsemen in psychology. And it's basically focused on 4 different communication techniques that will determine whether a relationship is likely to end in divorce or in separation or not. And basically these 4 communication techniques are defensiveness, criticism, contempt, and stonewalling. So criticism, we all know,
Yes.
we've experienced being the person criticizing or being criticized.
Definitely,
Yeah.
we've all been
Yeah.
there.
It's a very common experience where you see an issue in your relationship, and instead of having a productive conversation about it, you start pointing fingers and criticizing your partner. As a result, that turns into the second communication technique, which is defensiveness. Naturally,
Yes.
if I feel attacked, I'm going to defend myself.
Definitely.
Yeah. And then we're in this cycle of attack, defend, and there is no productive benefit of the conversation that we're having.
Yes.
Stonewalling is, as the title mentions, it's when the partner is trying to communicate with their significant other, and the significant other is just like a stone wall. They're not
Yes,
responding.
nothing.
Yeah, and that can be perceived as carelessness. They don't care about me. They don't love me. They're not interested in fixing this issue. And then the last one, and the most detrimental communication technique, is contempt, and that's basically criticism on steroids.
Okay.
It's like
As
a
if
criticism.
you needed that.
Yeah, it like supercharged. It's very mean. It's very aggressive. It's me criticizing you in a way that is extremely degrading, and that can actually be then perceived as emotional abuse when you're abusing your partner through name calling, through pointing out things in a very, very conniving way.
I can see how that happens. And of course, I think these issues will bring along bigger issues and more emotional, maybe physical abuse in the future. But where do the kids come into play in this situation? Because we hear a lot of couples, after 20 years of marriage, we're still together for the kids.
Yeah.
But the kids are being emotionally abused,
Yes.
seeing the issues, the fights. What are the kids feeling?
Yeah.
What's happening?
Yeah, that's a very important point. That sentence that we hear a lot is
A lot.
we will stay together for the children, when the reality is staying together is actually causing much more harm than any sort of separation or divorce. The effects can be very harmful. A lot of times children, who's the secure base for these children? It's the parents. And as soon as that secure base is shaken, the children feel like there's a lack of safety. So that's going to cause a lot of worry, a lot of fear. They might start to become more shy, more reserved, more quiet.
Yes.
They feel like they don't want to interrupt what's going on. So in their head now, my needs as a child is no longer important. What's important is, what my parents are going through. And so they're silenced in a way.
Yes.
In other cases, they can start to actually act out. So because they feel unseen, they feel unheard, the parents are very distracted with their own issues, so the child is not being taken care of, so they start to act out as a cry for help. I'm here,
Yes.
I need you, and I'm not receiving that, kind of care from my parents. They can also, children learn how to understand emotion, express emotion, behave and react based on what they see at home. So if they're
Yes.
seeing those behaviors, they're going to mimic those behaviors. If they're not mimicking it at home, they're probably doing it at school or in
That's
social
right.
settings.
We do notice a lot, Dr. Abdullah, that when teachers or principal calls the parents and your kid's being naughty, destructive, there's always an issue. There's always a child telling their teacher that my parents have been fighting. So how do you deal with that, and do you see those effects on the patient later, like patients you see at an older age, just issues from their childhood and the issue with the family?
Of course, how you were raised as a child and your parents, how they were there as a support system, really plays a big role on who you become as an adult.
Yes.
The way even you end up raising your children is based on that. And it's even as simple as sometimes parents end up, for example, doing everything their parents didn't do for them, and they do it overboard. So my parents never bought me gifts or toys, so they just buy toys every day and excessively. Or the other way around, my parents were very loose, so they become very strict. So it's a big aspect of who we become as human beings, and as adults is basically who we are as how we were raised as children. But one of the biggest things we tend to also see as problems with children in any relationship is sometimes the children blame themselves for the problem, because they think that they are the cause of the fighting going on between them. Because a lot of times in a relationship where there is children, a lot of the time the misconceptions of the problems are based on how children, what they're supposed to do, when their bedtime is, or when their homework is. So children are very easy triggers to arguments with relationships. So because of that, because the fight is instigated by that, the child tends to see that I'm the fault, I'm the problem.
Definitely.
So when we talk to them later on as adults, and we ask them, well, how's your family atmosphere growing up? And this is a very common question we tend to ask even in a diagnostic process, is how's family atmosphere growing up? And a lot of times they tell you, well, it was tense, it was unstable, there was parents' problems. And it's very rare we tend to see someone that eventually gets diagnosed with a mental health condition that tells you, well, I had a perfect household. Sometimes it happens. It's not unusual that we say, well, everything is perfect and I still have the condition, because at the end we're talking about it's a biological disease of the mind.
Right.
But it's a very often thing that we see is that it's triggered by environment. But I think if an important thing that we need to know is research has shown multiple times that a child that has two parents significantly does better in life. But the thing is, these parents have to be agreed upon and they're doing well together. So it's not just because being there as a human body means you're going to do well. They have to be parents. So sometimes splitting up is more of a solution than being together and forcing a relationship to be there for the children. So we always, when we're in couples therapy, we say children are important, but never stay together for the children, just for that. And if there is no kind of dynamic of working together, because the dynamic will eventually lead to a place where it breaks. So it plays a huge part of who we are as people, is what we tend to experience as children.
Definitely, because if the child is just being traumatized at a really young age because of their parents' relationship, maybe it's better if the parents live their separate lives and start dealing with the children collectively, where it's a more peaceful environment, hopefully. So before we end this evening, do you think that all couples need therapy? We'll start with you, Dr. Sara, but I want to know both of your opinions.
Yeah, so I don't think all couples need couples therapy, but all couples can benefit from couples therapy. You don't necessarily have to be, going through really major issues for you to go to couples therapy. Some couples can actually be at a stable phase in their life, but they might be going through a transition and they're having a bit of difficulty adjusting to that, and so they would want, somebody to help them get through that. They might be facing a completely new stressor in life that they're not used to, and they might need a bit of support going through that. So no, not all couples need it, but I think that if couples do decide that they'd like to explore it and experiment with it, they should definitely do it and take that into consideration. Another thing that I think also I would like Dr. Abdullah to add to it, because it's more fitting in his area, is, when we have couples that come in and one of them during individual therapy is on medication, has a diagnosis, they're about to get married, and they're not sure if they should share that with their couple or not, and whether they should include their partner in the sessions just to kind of get more information on the diagnosis, on the treatment plan, so that they can, feel supported and feel like they can share a big part of them. So that's a bit more in
that is a very important point, because as Dr. Sara said, not everybody will need it, but I don't think even if you're a very happy couple, nobody will find a downside of going to couples therapy. So even if you go to one session and you just talk it out, sometimes you might find things that is maybe upsetting you a little bit, and there's a better way to communicate it, or to send the message to the other person of how you feel. Because some couples do that naturally. They have this understanding and they do it, and sometimes they're a little bit more reserved, and that just allows them a place to express themselves, and becomes more of like it's like, let's say it's a playground where you can express your thoughts without any kind of you being worried about how it can be perceived. But a very important point that Dr. Sara brought is that this is a very common thing, that we have a patient that comes in with that we have been dealing with them as an individual, being treated for any kind of mental health condition,
Yes.
being on medication, and they ask, how do I let my significant other know that I have this mental condition, and how do they understand what this mental condition means? Because
Yes.
we tend to have as this whole issue is, this topic is taboo. There's not a lot of awareness in it, and
That's
when you
right.
tell someone, well, I have this condition, they might just think of it as you're not stable as a person, but which is very inaccurate. And
Yes.
this is a very good way for us to bring them in. And this the therapy is more about understanding how this condition is going to affect the marriage, how you have to deal with it if there's any kind of downsides of dips in the condition, how the other partner can help the other person, how they can support them,
Definitely.
how they can be aware of potential symptoms, that they can be the early intervention to bring them in.
Of course.
Because now they're with them in the home, so they can tend to know all these things. So this is also a kind of a thing that we need to look out for, is couples therapy can be not just to heal problems, it could be educational. And just educate yourself on how to move from an individual lifestyle to a couple living together for the first time together, you know?
That's right. And usually we see the biggest issues between couples during their first year of marriage because they're getting to know each other. It's different when you're in each other's faces all day.
Of course.
Issues do come up, and that's completely normal for us. Dr. Sara and Dr. Abdullah, thank you so much for being with us this evening.
Thank you so much for
Thank you,
having
Rita.
us.
Thank you. Dear viewers, we had with us Dr. Abdullah Habib, Doctor of Psychiatry and Director of Clinical Neuropsychology at Mindwell, and Dr. Sara Alsayed, Doctor of Counseling, Psychology and Director of the Department of Psychotherapy and Counseling at Mindwell. We're going to be viewing a report on Al Barawa. Please stay tuned.